into the connective tissue in response to the stretching, and this is one of the mechanisms by which the fibroblasts can change shape. And importantly, ATP is a molecule called a purine, and that has been implicated in sensory signaling and can even be converted to other molecules that may have analgesic effects. So we're very interested in this type of signaling that occurs in the tissue. So, you know, again, I think one thing that I want to mention is I talked about stretching, but we're also interested, of course, in the effects of not stretching. And we have some animal models. Here's an example. We have a pig model at the University of Vermont where we restrict the amount of motion that the animal is able to have by simply connecting a strap to the leg, to a harness. The animals adapt to this very well. They're still able to walk, but they are not able to stretch as much when they walk, and they cannot extend their back leg. And we are interested in looking at the connective tissues of the back to see if they remodel in a similar direction to when people have back pain and the connective tissue thickening that and lack of mobility that I showed you earlier. And another important thing that we're interested in, as Dr. Wayne mentioned, is what is the optimal dose of tissue stretch? It's very important to know how much, because if you stretch too much, you can actually injure oneself. And so I think that this is a very important thing, that when we look at a mechanism like this, this is where we can actually do some dosing studies and see what are the different, how long should we stretch, how much, what should be the amplitude of the stretch, and how often should we do it. Same thing with Tai Chi. By doing sophisticated measurements, it's possible to look at the dose of Tai Chi and look at it at a global level, but also break it down into different components and look at the dose of that. So I'm just going to want to just summarize here by showing how all of the different levels that we can look at kind of ties together. So for example, I've talked about, we've all been talking about Tai Chi today, and I have talked about low back pain, but it could be a number of different, conditions here. As far as we looked at integrated function, so an example of integrated function that both Dr. Wayne and myself talked about is gait, right? We looked at gait in the animal, in the rat, but we can also look at gait in using sensors in humans. So this is something that we call a very translational measure, because we can do it across experimental models. Then in terms of in vivo physiological measurements, okay, I've talked about tissue mobility and tissue structure. These are examples of specific types of measurements that can, again, be done in a translational way in humans and also in animal models. And finally, the last level is I talk about at the cell and tissue level, I talked about the cell signaling, which of course happens, we think happens, very difficult to measure. You cannot measure cell signalings in a live human being, but you can do it in a more focused experimental system. So how do all of these things, and this kind of spiral kind of thing, where how do all of these things relate? And I think that this is where we can look at these different levels of research at what's called a translational level, right? We go all the way from a cell culture dish to a tissue to an animal and to a human, and then the job is to integrate all of this and to make sense of it all, and to see, obviously, what I've presented it is a very much more narrow view. We also, because I talked about just stretching, and of course Tai Chi is not just stretching, but there is some stretching in Tai Chi. It's one of the components. So we have to now, the job is to integrate that with the other components. And I want to acknowledge the people who've contributed to the research that I have presented, and collaborators, the University of Rochester and Columbia, as well as the funding from the National Center for Complementary and Alternative Medicine. Thank you very much.
So as Julie mentioned, really what we do research for is to make a difference. and when the rubber hits the road, we can actually make a difference in people's lives. And I'm going to share a little video that some people in this room were part of. It is a joint program that's sponsored by the Beth Israel Deaconess Medical Center's Movement Disorder Center, as well as the OSHA Center at Brigham and Women's Hospital. And it gives you an idea of what goes a little bit further to this translational scheme that Dr. Langevin showed, where this translates out into community programs. But it's bi-directional, because what we're learning in our community programs informs the questions we're asking and the research we pursue. So it's a bi-directional research program. So, thank you.
Learning that I had Parkinson's was devastating. Tai Chi enabled me to build a relationship with my body again.
Tai Chi teaches you how to make your movements more graceful, so I feel more at ease.
When you see your body relaxing, it does make you feel better.
Even up into your upper arm, just kind of gently bowing and stretching. Switch.
Parkinson's disease is the second most common neurodegenerative disease after Alzheimer's disease. For some time I've been suggesting Tai Chi as an alternative to conventional physical therapy, as an intervention for people with Parkinson's disease who are experiencing balance difficulty. With a greater awareness of the effectiveness of it, we are recommending it earlier.
And even down into your legs and feet and toes. Feel them breathing too.
Tai Chi is commonly referred to as a mind-body exercise, a kind of meditation in motion. It integrates slow, relaxed, circular movements with deep, conscious breathing and a number of cognitive skills like focused attention, whole body awareness, and it uses imagery and visualization. The goal isn't to learn complex sequences of external choreography, but rather we use simple movements that allow people to focus on the core principles that we believe are most therapeutic in Tai Chi.
It engages me in a way I've never been engaged, the kind of movements you do or you don't do in anything else, you don't do in any other sport. What I enjoy so much is the sense of connection to my body, the ease of doing it, and the relaxation and sort of confidence of balance that I feel at the end.
What's cool and different about Tai Chi is the fact that it's very non-stressful and very quiet, very graceful. And what I enjoy mostly about it is that it's converted me to a large extent from being focused on what happens next rather than being mindful of the present.
One of my challenges is I have significant tremors in my left hand and left leg, and the Tai Chi helps to relax the muscles. I notice a benefit right away seeing other people with the similar conditions. Makes me feel like I'm not alone.
With Parkinson's, there's a reluctance sometimes to be social, and couples suffer. Being together, having fun in some kind of a program like Tai Chi, where both people have a shared experience that is a positive one and even a fun one, is extremely important.
If I have any anxiety about Jim's condition, then it's certainly I'm able to relax. But I think also as a spouse, it's a way that we can support each other and be in a group setting that's safe, and it's just a very nice group of people to be with.
And when she doesn't feel like going backwards anymore, she's going to roll me off to her right, and our hands are going to go roll. And now her hand is
There's a growing body of research evaluating the health benefits of Tai Chi. To date, there's probably more than 150 randomized controlled trials, and there's some good evidence that's emerging from this literature.
And there's one published study that documented that 6 months of twice-a-week Tai Chi with an emphasis on balance was able to improve balance, and they compared those patients to two other groups, some patients that had conventional exercises. And it wasn't even close. The Tai Chi group had benefit that was measurable compared to the non-Tai Chi groups.
All right, very good. Thanks for coming. We'll see you next week.
I'm 5 years into this disease, and I have pretty much no doubt that I'm doing as well as I am because of Tai Chi and all the different movement programs I'm a part of.
I would recommend it completely to anybody who's newly diagnosed or is the spouse of somebody or a friend or a family member of somebody who has Parkinson's, because you'll reap so many benefits. The health benefits and the support system is really fantastic.